If you're trying to avoid a $20,000 sports hernia surgery, you should try our virtual surgery here today. Today we are pretending to give you a sports hernia surgery, which means you are resting today, you're not going to go work out tomorrow, and you're not going to go play sports for a few months. This may seem silly, but I do believe that some people who get better after surgery is because they are forced to rest and recover in a structured fashion. I've worked with tons of people who have been able to return to soccer, sprinting, and hockey without having to do any surgery. I'd like to thank Stuart McGill for proposing the concept of a virtual lower back surgery in his book. In this 4-part series, we're going to go over the basic outline of the first 6 weeks of the virtual surgery. Weeks 1 and 2 is basically rest. This video starts at that 3-week mark. The goal of this week is to decrease pain. Days 1 through 3 is intra-abdominal breathing and some basic breathing exercises. Days 4 through 7 are green light, safe movements to do on the floor. Stay tuned to day 7, that's where the fun starts. This breathing part is so important. Sometimes when we teach it to people, we ask them to do it for a few days to really make sure that you're honing in on this skill, because it does get taken into other exercises moving forward. So what we're gonna do is lay on our back. A lot of times I like to have people to be on more of a softer surface so that your pelvis and your low back can really sink into that surface. We're going to work on posterior tilting. So what that looks like is here with the belly button up to the ceiling and a little tunnel under your low back, that's more of an anterior tilt. We want the opposite. So we're going to roll the spine down to the floor, and we're going to use the lower abdominal muscles to pull the pubic bone towards your face. Okay, you're going to start to feel a little activation into the belly there. Then what we're going to do is take our fingers and we're going to first start to breathe below the belly button. So here, if we take a big deep breath in, you're doing it right if you feel the muscles underneath your fingers push up to the ceiling, okay? If you feel like you got that right and you're keeping your posterior tilt, the next part is a deeper breath into the sides here. I like to ask people to find the hip bones on the side of their body here. Come up until you don't feel bone anymore. It's now just that empty space on the side of the body. When you breathe in, you should feel like your thumbs get pushed away from each other with your breath. Here's how that looks. For the breathing, we want you really practicing this for about 20 minutes. You can spread that throughout the day in different increments for the first few days. The next part is going to be taking that breathing and building it into a bridge. We want to start to activate what we call the posterior chain, so the glutes, the hamstrings, to offload the injured area. So how we're going to do that is take our fingers to those spots we just worked on. We're going to breathe deep into them. Keep some stiffness there as we start to lift into our bridge and back down. Okay, you can always change how high up you want to go. So let's just work through maybe lifting the bum off the ground and back down and pairing that with your breath. Lift and down. And after a while, maybe over the next couple days, you start to build in that height a little bit more. We really want to make sure that we're not hyperextending at the low back at the top. So that's why that breathing really helps you find more of that neutral pelvis, okay? Activation in the belly and just getting the posterior chain to work here. This one here, you're going to start with breathing for about 5 minutes. Then for another 10 minutes, you'll practice this glute bridging. However many sets and reps works for you in that time. Now on day 5, what we want to do is warm up and start, as always, with our lower abdominal breathing for about 5 minutes. So again, deep into the belly button and deep into the sides, practice getting even deeper into that each time. So after 5 minutes of practicing that, we're going to build some rolling into this, okay? So what I'm going to do is drop this leg here. We're going to use the heel on the opposite side. We're going to do that breathing to stabilize everything so we can move as one unit. Breathe deep into the belly and start to reach for something across the room. Okay, we're going to let that breath out as we return. Here's how it looks on the other side. Again, if you notice, if you push through your heel, your pelvis starts to roll, but we don't want any twisting motions happening. So stiff into the sides here so you move as one unit. Okay, and we're going to go for about 10 minutes, okay? You can stick to one side, stick to the other side, or transition back and forth, whatever works right for you. So for day 6, we're probably going to do a total of 15-20 minutes of movement, again, always starting with your breathing. But we're going to build that breathing and our bridges back in today. So we're going to see, if you haven't already, start to see if you can get higher into those glute bridges. Breathing into your sides, making sure you can keep that as we're doing the movement. Go for 10 reps here, okay? And then what we're gonna do is build our rolling back in. Let's go for 5 on one side, and then 5 on the other side. Okay, circuit through that. Come back to your bridges, go for 10. Get a little higher this time, making sure, again, that we're not hyperextending at our low back. Everything looks neutral, okay? And then 5 more to the left, 5 more to the right, until you reach that activity time of about 15 to 20 minutes. Okay, so day 7 is one of my favorites. We're gonna build a new exercise in today. So if you're not ready for progression, you feel like pain is still there, maybe there's not a whole lot of improvement happening, please click on the link, which is a link to our free sports hernia recovery plan. If you haven't already checked that out, please do so. So for today, again, our 20 minutes of movement is gonna be similar, but we're gonna have something new. So we're gonna start with our breathing, try 10 reps. Today we're then going to get into our bridges for 10 reps. We're going to roll to each side for 10 reps, okay? And then what we're going to do is we're not quite ready to sit up when we get up off the floor, so we're going to take that roll and we're going to come all the way to our belly, okay? And then we're going to come up into a tabletop position here, okay? Number one thing in this new exercise called the high bear is to make sure that you're in as much neutral position from the top of your head to your tailbone as you can. So we don't want this cow position or this angry cat position. We want somewhere in the middle. And you want to make sure, now that we're up off the floor, you're challenging your breathing in a different way. Can we, in this position, breathe into our sides and breathe deep beneath the belly button? Don't move forward if you can't, okay? Now we're going to tuck our toes, and we're going to try to push this carpet through the earth. Hold, 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 hold. Breathe, breathe, breathe. Take a break. You notice if we push even harder with that, our knees are going to start to lift. We're going to see if we can tolerate that while we breathe and hold. On the next one, we're going to see if we can get a little bit higher. And we're going to hold here to tolerance. And then on the last one, these are all progressions, so only do what you can. Get high, stretch the pockets on the back of your pants, breathe, and return. And we're going to try 5 reps of that. If we're here, let's do it together. Pushing deep through the floor, sitting into our back pockets, breathing here, letting the quads do some work, and controlling it back down. The last part of this week, if you haven't already done so, is making sure that we are walking on a day-to-day basis. You want to start to reach upwards of an hour of walking a day. If you can tolerate it, do it all at once, or you can split that up throughout the day to reach a total of 1 hour. Stay tuned for part 2, which will get you into week 4 of our virtual surgery.